start with anticoagulants. As the name says, anticoagulant against coagulation. So they stop what? Clot formation. Now, take note, anticoagulants are not thrombolytics, which breaks down clot. Anticoagulants prevent already formed clot from getting bigger and prevent further clot formation. So in layman terms, they call them blood thinners. We use anticoagulant in conditions like myocardial infarction, which is what we call heart attack, in pulmonary embolism, in deep vein thrombosis. I discussed that in my previous lecture, where there is formation of clot in the deep veins. So when a patient develops such clot, they first put the patient on anticoagulant to help resolve, to help with the clot from getting bigger and new clot from forming. And in a way, the body will also start and then the clot is resolved. It's only when the clot gets too big and anticoagulant is unable to take care of it, they may put the patient on other medication, including thrombolytics to burst the clot. But that one has a risk of massive bleeding. So we'll look more into that. We also use anticoagulant in conditions like atrial fibrillation, in pacemaker, those that use pacemaker, sharp pacemaker, mechanical valves. Anticoagulants are of three classes. We have the vitamin K antagonist. This one stops the liver from making vitamin K. And if you remember, vitamin K is needed for clotting of blood. An example of medication in this vitamin K antagonist is warfarin, or what we call Coumadin. We will also discuss that shortly. The second class of anticoagulant is the indirect thrombin inhibitor. So you say indirect because it doesn't act on thrombin directly. It acts on antithrombin 3, which will stop the action of thrombin from converting fibrinogen to fibrin. So in a way, anticoagulants, one of this class, which is example heparin, will not act directly on thrombin, but it will empower the antithrombin 3 to act on thrombin. So an example, like I mentioned, is heparin, and we have two kinds of heparin. It can either be unfractioned heparin or low molecular weight heparin. The advantage of this low molecular weight heparin is that you don't need to be doing all those monitoring of the APTT values. Example of low molecular weight heparin include heparin, which is what we call fragmin, and enoxaparin, which is Lovenox. The third class of anticoagulant is the direct oral anticoagulant. So this one is given only by mouth. And there are two types. We have factor SA inhibitor and direct thrombin inhibitor. For factor SA inhibitor, it inhibits factor SA, the clotting factor, from making clots. An example is apixaban. We also have rivaroxaban, Xarelto. For direct thrombin inhibitor, they inhibit directly the action of thrombin. An example is dabigatran. Let's look more into heparin. You need to really know heparin as a nursing student because NCLEX, they like to bring up this question a lot because any medication that put patient at risk, NCLEX is testing for risk safety. They want to make sure you know about this medication because a change in this medication, if you don't know how to use this medication or monitor a patient in this medication, it can put patient at risk. So heparin is given through two routes. One is through subcutaneous route to the subcutaneous tissue, the hypodermis layer. And the second one is through the IV route, intravenous route. For the low molecular weight heparin, it is basically given through subcutaneous route. But for the unfractioned one, it is given via IV route, especially for the continuous drip. Then if the unfractioned one is prefilled, is packaged with a prefilled syringe, you can give it subcut. Heparin has a faster onset, so it's used in an emergency situation, in an acute onset, because a patient cannot be on heparin for a long time. So you need it for that immediate time. You need it immediately. And as it has faster onset, it also has a shorter duration. So you are not using it for a patient a long time. So if a patient has a condition that will require them to be on anticoagulant for a very long time, they will also put them on warfarin. Because warfarin, I will discuss that shortly, it takes longer time before it peaks, basically 3 to 5 days So they put them in, patient is on heparin. When warfarin kicks off, they can remove the patient from heparin, then they continue on warfarin. Now, heparin is weight-based. If we are monitoring or we are putting patient on continuous drip of heparin, we check the patient weight, very important. We monitor the APTT level, activated partial thromboplastin time. You need to know the normal level for someone that is not on heparin at all, between 30 to 40 seconds. So if somebody is on heparin, the patient is on heparin, we want to increase that time to a therapeutic range of 1.5 to 2 times higher. So you don't need to cram this. What I do, I would say the therapeutic is 1.5 to 2 times higher. So 1.5 plus 2.5, you have 4. Divide by 2, you have 2. So 2 multiplied by 30, you have 60 seconds. 2 multiplied by 40, you have 80 seconds. So for therapeutic range, for someone already on heparin, the APTT or PTT will be 60 to 80 seconds. Another important thing you need to know about heparin is that it is safe in pregnancy. Very important. And the antidote for heparin is protamine sulfate. Take note of this, protamine sulfate. Complication of heparin can be thrombocytopenia. So this thrombocytopenia, we call it heparin-induced thrombocytopenia. So that means when a patient is on heparin, you are also monitoring the platelet. And when patient is on heparin too, patient is at risk of a complication we call osteoporosis. That's the demineralization of the bone, where the bone becomes very fragile and can break easily, especially when the patient is taking heparin for a longer time. Now we look at warfarin, which is Coumadin. Now, Coumadin is prescribed after the acute stage of heparin. After heparin have started the work, they started using heparin, they put the patient on warfarin. So because warfarin doesn't kick off immediately, so you can't start a patient on warfarin immediately when there's a need for clot to be taken care of. Now, I mentioned it earlier, the physician, the prescriber will put patient on both heparin and warfarin, waiting for warfarin to kick off before removing the patient from heparin, because warfarin can be taken for a longer time. It starts slowly, so it has a slower onset. It takes like about 3 to 5 days for warfarin to begin to kick in, and it lasts for a longer time. So patient can be on it for a very long time, and it's taken only by mouth, same time every day. If the patient is taking it, you can educate them that if they forget to take the medication and it's within the same day, they can still take it. But once it passes that day, they should not double dose. Rather, they should let their healthcare provider know and take the usual one they are supposed to take. For warfarin, you are monitoring the PT level, which is prothrombin time. Don't mix this up with heparin. Heparin is PTT level, the one with double T. But this one is PT level, the prothrombin time. And you're also monitoring the international normalized ratio. For a patient that is on warfarin, we want it to be in the level of 2 to 3, the INR. The level should be between 2 to 3. So if a patient is on warfarin and they're having 4 as INR level, we are suspecting that it's working too much. The patient might bleed. We want to look into suggesting to the healthcare provider maybe to reduce the medication. But if it is less than 2, we are looking at it that the warfarin is not peaking enough, like it's not enough. They may need to increase the dose. Then we need to know, unlike heparin that is used in pregnancy, warfarin is not safe in pregnancy. So take note of that. And then the antidote for warfarin is vitamin K. Take note again that alcohol can interfere with warfarin. So you want to educate patients that are taking warfarin the need to avoid alcohol completely. That brings us to the nursing responsibility for patients that are taking anticoagulants. Now, as nurses, want to educate them to watch out for risks for bleeding. They should report to you any sign of bleeding from their gums. It could be from vomit. They should tell you how their vomiters look like, MSs. Their urine, is it dark color? They should tell you, is it different from the pale yellow or amber? Their stool, Malena, is there blood in their stool? Is their stool looking too dark, looking somehow different from the usual? They should report it when they are taking any anticoagulant. Encourage and advise them to use soft toothbrush, and they should not brush too rigorously so that they don't start bleeding, because they can bleed easily. You also want to educate them on the need to use electric razor. And then they should be consistent in their dieting, especially with intake of any food rich in vitamin K, like green leafy vegetables, like spinach, broccoli. You want to advise them that when they are taking this, they are taking any anticoagulant, especially warfarin in particular now, they are taking warfarin and they are eating green vegetables. They should be consistent. We're not saying they should decrease their vegetable, neither are we saying they should increase. They should be consistent because green leafy vegetable is high in vitamin K. So it's as if you are taking the antidotes. You are taking warfarin and you are taking the antidotes. You don't want that. If it interferes, it's as if the warfarin is not going to work. And that will make your healthcare provider to keep changing your dose. So we encourage them to be consistent. They should eat the same amount they eat regularly so that the healthcare provider will know the exact amount, the prescription to give for the warfarin, and they won't be changing it and all that. And then also you need to advise them to not use any NSAID, non-steroidal anti-inflammatory drugs, together with anticoagulants. They should not also take aspirin, which is acetylsalicylic acid, when they are taking anticoagulants. So advise them on that, very important. And even also over-the-counter medication, advise them they should not take any of this medication without their healthcare provider approval. If you enjoyed this topic, please like, share, and subscribe. You can also leave your comment. Thanks for watching.